Assalamu alaikum, the communication day. First scenario, Mrs. Mona is 55 years old, was admitted 2 days ago after extensive ischemic stroke with left side weakness. 24 hours after admission, her condition was deteriorated and she went into coma. Repeated CT brain didn't reveal any interval change. Since day one of admission, she received aspirin in the best interest of her condition and pantoprazole for peptic ulcer protection. Her daughter, Mrs. Daila, is very anxious because of her deterioration of mother condition, and she's angry because of aspirin therapy, as her mother had a history of upper GI bleeding 2 years ago as a result of aspirin. You are the senior house officer of the medical department on call today. You have been asked to discuss this issue with Mrs. Daila.
Okay,
Okay. You're ready, Dr. Salma, right?
inshallah.
Okay. You can see the timer. Here you go.
Hello, my name is Dr. Abdurrahman, the doctor in the clinic today. May I confirm that I'm speaking to Mrs. Layla, the daughter of Mrs. Mona?
Yes, doctor. Mrs. Laila, the daughter of Mrs. Mona, 55 years old.
Welcome, Mrs. Layla. And are you the next of kin of Mrs. Mona?
Yes, doctor, I'm the next of kin.
So, Mrs. Layla, we are here today to discuss some issues regarding the health condition of your mother. But before we start discussing, can I know how much do you know about the health status of your mother?
Yes, doctor. My mother was admitted to the hospital from 2 days because she had a stroke. Yesterday, they told me her condition was severely deteriorated and she went into coma. And
Mm-hmm.
also, she received aspirin. And I told the doctors that she had allergy for aspirin as she developed some bleeding from this aspirin 2 years ago.
Mm-hmm. Okay, appreciate your knowledge regarding your mother condition, and I'm so sorry for what your mother has to go through now. Um, I can feel that how much is this frustrating for you, but don't worry, we are here with you, and we are taking care of your mother. So, Mrs. Leila, can you tell me what do you expect from our meeting today?
I expect doctor and my mother why she's deteriorated. I want to know why she has deteriorated. Is it because of aspirin?
That's a valid concern, Mrs. Leila. I appreciate that you are caring about all the aspects of the health of your mother. And yeah, I will be more than happy to discuss with you the condition of your mother and why she is deteriorating now. So, as you mentioned, that she came here with a diagnosis of a stroke, that is a clot in her brain. And as a result of this diagnosis, which was confirmed by doing the scans, the treating doctors had decided to start a blood thinning medication, which is aspirin, which is the cornerstone management in such cases. And yeah, about the history of your mother, that she had a bleeding from her gut 2 years ago because of aspirin. They took precautions in order to prevent that by giving her another medication called pantoprazole. That is a medication to protect her gut from bleeding again. Are you following me?
Yes, doctor, I'm following with you. Okay, why did you give her aspirin while she is allergic to him? She's allergic to
Okay.
that medication. You gave her this medication that causes her bleeding before. Would you give her that medication?
Mhm. So, Mrs. Leila, before answering your concern is very important to me, but I need to ask you a question. can you explain to me what do you mean by allergy? Is it the bleeding from her gut,
Yes,
or she
doctor, the
has?
bleeding. Yes, the
Okay,
bleeding that she had before.
okay. So just let me explain to you something. Maybe will change your mind. That bleeding from her gut is not an allergy. It's a different thing. It's a side effect or bad outcome of a medication. Uh, like this is a blood thinning medication, so sometimes it can cause bleeding uh, to some people, but it's not actually uh, it's not actually
Okay, I see, doctor. You mean this is not allergy, this is side effect from the medication. Okay, and
sorry.
how do you know, doctor, if she's not bleeding right now from the
Okay,
gut like before? How would you know
appreciate.
that?
Yeah, I appreciate your concern. Your mother now, she is under the care of a group of doctors. They are following her up. They are observing her condition, and they give her this medication pantoprazole to protect her gut from any possible bleeding. Aspirin is like any medication has side effects, has bad outcomes sometimes, like bleeding, uh, like allergy also. But these side effects, when given in a suitable dose, it is. I cannot say it will not happen, but the possibility of happening is minimum. And in the condition of your mother, the benefits of taking this medication outweigh the risks, and the risks are minimizing by the observation and the close following up with the treating doctor. Yeah, here with us, and they are following her and observing her all the time, in
Then
case.
why she's deteriorating, doctor? Why she's
Mhm,
deteriorating? And I think the aspirin may be the cause for her deterioration that you gave her.
mhm. Uh, it's a good question, Mrs. Layla. Yes, why she is deteriorating. Your mother has got a clot in her brain, and sometimes we this clot in the brain can affect certain areas in the brain, which is controlling her her awareness. Sometimes other areas in the brain, and in the situation of your mother, that is the bad outcome of the stroke itself. It actually has no relation with the aspirin. Aspirin is the management in this case. Uh, 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 that's why the deterioration is related to the stroke itself. Are you following me, Mrs. Layla?
Yes, doctor. And what you're gonna do regarding this deterioration? I think I'm losing my mother.
Thank you for raising this question. I can feel that it's very concerning for you. And yeah, you have all the right to be concerned because your mother's situation is serious, actually. Uh, so what we are going to do now, we are going to continue uh, caring for her or observing her situation, and we are going to continue to give her the management that we are giving now, and hopefully that she will respond to that. Uh, but in case that she didn't respond to this treatment, which is
Two
given
minutes
by
left.
yeah, given by this group of doctors, I need to ask you some questions, if you allow me. Is it okay with me, with you?
Okay, doc. Okay.
So, uh, do you know much about if she expressed any wishes when she was okay about how she wants to be treated in situation that she cannot take a decision by herself? in
No,
situation that if deteriorated more, like if her heart stopped or anything else?
no, doctor, she didn't quite tell us
Mhm.
about that. That was all of a sudden, and she was admitted all of a sudden, actually. She's 55 years old.
Mhm. Yes, yeah, I can see that she's still young, and that is a good thing in her situation to be able to fight this situation. But we need to plan for the future management also, in order not to be issued. So there is no any advance directive or she didn't appoint anybody to take any decisions in her behalf.
No, doctor, nothing like that.
Okay. So in this situation, when her condition coming to deteriorating further, hopefully not, this will be the team will evaluate her condition and decide further. So with whom she was living, your mother?
She was living with me and my brother.
Mm-hmm.
She was the one taking care of ours.
So you are dependent on her. So
Yes.
yeah, do you need any support, any help?
Yes, doctor, I don't know what to do after my mother.
Yeah. And yeah, it's okay. We are going to involve our social workers to see how can they help you. Uh, okay. So, how was your mother before this happening? Was she working and depending
Yes,
in herself in the activities?
yes, doctor, she was working on the building.
Okay. Okay. So, hopefully, that the management will be successful and she will be under uh, uh, ongoing treatment. So I'm going to give you some leaflets and brochures about this condition and about also aspirin and the bad outcomes and good importance of the aspirin in such situation also, and the difference between the allergy from aspirin and the other things related to your mother condition. Do you need any other support? Any other? Do you have any other concern or anything?
Okay, time is up. I added 1 more minute to
Why?
address all of.
Why you added
Yeah,
one more?
I can feel.
I'm
I
very
can
tired.
feel. I can feel your suffering. Okay,
The concern is speaking up, speaking loud.
okay. Let's hear the comment from Dr. Ahmed. Then I will comment. Well done, Dr. Sama. By the way.
Yes, well done. Actually, you have covered most of the case. You have covered all the things. Um, only the concern and the time that you took most time explaining. But actually, you didn't miss anything in the explanation. You offered to her that aspirin is this is not allergy from aspirin. This is due to gut bleeding. Also, you said that this is outweigh the risks versus the benefits of aspirin for your mother, and this is the main cornerstone, and this is important. And also, when I asked you how would you know she's not bleeding, you answered this well. You can also answer by that we are following her blood count and following any side effects of aspirin in her, observing her closely for any bleeding. And if this happened, we would stop this medication in order for the surrogate just to keep calm.
Hmm? Noted.
Also, but that's all. Only the concern.
Yeah.
The
Did
Any
she
concern
any
ask
any
for the
other
consent?
concern you wanted to add, Dr. Ahmed? Any other concern that
the
was there?
concern was something. Do you think I have to call my brother to see my mother
Okay.
as he's living in another city?
Mhm.
I asked you several times why you did not tell
No,
You
no.
me
asked about
The
concerns?
lesson,
No, no, no.
the lesson from Dr.
any
Ahmed and
other.
from every session. Whenever you
Uh,
Hmm.
hear 2 minutes left, stop
Yes, بالظبط.
talking
mm,
Stop talking.
Exactly.
And ask about concern.
Ask about
Yes.
concern. Yes.
Then
Mm.
continue whatever you are trying to talk
Or
about.
should, yeah, try to be brief in the coming minute or the coming topic you are talking, and give her or
Mm.
give him a chance to express the concern, the last concern. 2 minutes left.
Mm.
He want to address specific concern already instructed by examiner, and he should tell
Okay.
this at this 2 minutes left. He will not tell this concern all the time. I mean,
Mm.
for in the rest of the examination time, in the 8 minutes, he keep this concern at the end. It was
Okay.
instructed by examiner to only express this concern after 2 minutes left. So you have to be quiet, stop talking, or finish the talk you are talking, and give him chance to express the last concern, and simply address it. It's simple to address, and you know how to address this thing, right?
Yes.
So what to do if he asks you, my brother is living away, and
Mhm. So I appreciate your concern.
yeah,
Yes, your brother should know about your mother condition. We can help you in this regard. We can even talk to him in the in telephone, or it's better also to call him here because this will be good for him and for your mother also as well.
perfect.
Mm.
Can you, doctor, let her stay alive till my brother will come? This is another concern, also related to the previous concern.
Mhm. Uh, um, let her
I,
alive. You mean if
yeah,
it is end of life
extend, yeah,
issues? Yeah,
extend the life, yeah, if you
yeah,
can.
but, yeah. Actually, we cannot decide about the life of someone. It's not in our hands. But we you are talking about end of life issues, not like this
Yeah, but
scenario.
some,
It is
it might
comatose
be
But you
only.
have
also,
discussed the advanced directive, Dr. Salma, and
Yes,
yeah,
yes, it's also it's not written in the book, but I don't know. Maybe you can ask
condition
about.
deteriorated, you just touch it,
yeah.
and let them know about there is something like this very important. So if she regain her consciousness, she should plan for this in the future.
Mhm.
And
I
Yeah,
agree.
you
She
just
should be rest.
give them idea about it
idea
only.
idea
All right.
about it. Yes, yes. But about extending the life for your brother, if we are planning to end of life issues, we can wait for, yes, of course, we can wait for your brother to come and say goodbye to her and
Yeah, perfect.
spend some
Yeah, so
time
yeah,
with
we'll
her.
try our best.
Yeah,
However,
we'll try our
sometimes
best, we'll do that.
it's
Yes.
not something to be controlled with
Yeah.
by us.
Yeah.
And don't
You
forget
mean
to
goodbye to her while she's dead, or what?
not
I
in
can't
this
understand.
not in this scenario
before.
not in
And
this
yeah,
scenario.
in some
Yeah.
scenarios, Dr. Ahmed, some
End of
scenarios, end
life.
of life
Yeah.
care, they can
End
do
of life.
some measures to extend the life till the mother,
You
the
mean
son.
keep her on a
Yes,
ventilator until her?
exactly. Yeah,
Yes.
You mean like
Yes.
exactly.
okay, okay.
It's
Mm.
related to the same concern, which is can we wait for my brother to come, or shall I call my brother to come? So
Mm.
it's related to each other. It will
Yeah.
start by shall we call, and the next concern, can you wait for him to come? So it will
Mm.
be like this. The answer, like as Dr. Salma said, and don't forget to appreciate his or her care about seeing the mother by by brother. I mean,
Okay.
before answering any concern, try to appreciate or to I can see how much you are worried. You know, these phrases is very important for the examiner to hear. Okay.
Yeah.
Yeah.
Okay.
Anything else, Dr. Ahmed? She missed or you want to comment?
No, she covered all.
Yes.
Thank
The
you,
most
doctor.
important thing, as Dr. Ahmed said, is to explain and to clarify the thing. The allergy is different than the unwanted effect. I mean, I prefer to say unwanted effect than say bad effect. Unwanted
Yes.
effects that it's not by us, by our in our hand, but it happened because the medication always we have wanted effect and unwanted effect. The unwanted effect always, or the benefit outweigh the risk in the same way. So it happens and it's uncontrolled. But in your mother condition, we'll do our best to prevent it by started the medication. And as Dr. Ahmed said, we will do blood count. Don't forget this. Believe me, they love
Yeah.
the follow up
Yeah.
and care.
Mhm.
The word follow up for them like magic. If you said, we will follow up your mother, we will keep our eye on your mother, we will monitor your mother, we will do some blood test, follow up blood count, these things will reassure the daughter and will reassure the examiner, and he give you the mark. We don't care about the daughter, we care about the marks, right? So we want
Yeah.
the examiner be impressed by these sentences. Yeah, so we will take care, we will follow, we will observe, as Dr. Ahmed also said.
Okay.
Okay, anything else, Dr. Ahmed? I think you did it perfectly. About the advanced directive, I believe it's need to be done here. Why? Because the mother condition is serious and she went into coma. What's expected? We don't know. She might regain, she might worse. But once you have condition which is worsening and unexpectedly she will deteriorate more, you can raise this issue. Advanced directive. Why? Because you don't know what will happen in the future. Maybe she will express something will help your management plan. So the daughter will tell you she asked to die at home. She want to die in peaceful way. So better to mention, and we will respect this wish. Definitely respecting the wish, and it will help also and ease our management plan because we don't want to waste time by ventilator, the suffering also by this machine. It will help our management plan along also of along with the group of doctors. Okay.
Okay.
Anything else? Any comment by other colleague? Any suggestion? Don't
Yes,
forget to.
Dr. Rafa,
Yes, Dr.
Dr.
Mahi, go
Rafa,
ahead.
the surrogate asked why she deteriorated.
Yeah,
Dr.
good.
Salma said it is not from the aspirin, it is from
Yes,
the stroke itself.
perfect. Yes,
Scientifically, yes, this is from the stroke itself. When there is sizable stroke, the
yes,
next day and third day, there development of brain edema, and
perfect.
due to it is only limited by the skull,
Okay.
so damage of other neurons, so patient deteriorate. And the surgeon, we call the surgeon usually for this, and they do hemocraniotomy
No, no,
to
no, no, no,
prevent
no.
it,
Yeah,
to do
you are talking
no,
theoretically, right? Theoretically, but
no
perfect.
scientifically. Now we
Yeah,
are
yeah.
talking scientifically.
Yes, you're
So
right.
they do hemocraniotomy to
Okay,
prevent this increase of the brain edema to damage more the neurons.
perfect. Okay.
Yes.
But
She might recover.
in
You want to say that
the,
she might recover, right?
no.
Oh,
Uh, I speak about the clinical judgment. Now we are
okay.
talking not only to the surrogate only, but also the examiner is listening to me. So when
What
the Dr.
What do you think, Dr.
addressed
Mahi? Yeah,
انا
I
لسه بس
agree.
انا لسه بسأل
Okay.
السؤال.
Okay. Continue.
So
Continue.
now I wanted to address this concern by any way to embrace the examiner. It is by the stroke itself, not by the but not by aspirin. But I can explain more why this deterioration occurred.
The
It's from your
examiner,
time. I think it's
not,
from your time.
it's not about the time only. I think the examiner will be يعني impressed when you are talking to the layman in the lay language.
In medical,
Uh,
yes, in medical
yeah,
and
yeah.
scientific
But
communication.
Not
if
only
you
this.
if
In
if you
what
explain further medically,
Yes.
the
Yes.
the the examiner will not impress. The
Yeah.
examiner will be
Will be
upset.
angry.
Actually, will be
Yes.
angry.
Yes.
Yeah,
Exactly. Yes. I agree with Dr. Salma. Don't go
Don't
through the
go deep.
details.
You mean
Yes.
don't go deep through
Exactly.
explanation.
Yes. Why? Because the scenario, you should be strict to the scenario. What the scenario written? Deteriorated. Did they say or mention edema or expected to be deteriorated or something related to the skull or the size of the stroke? Nothing. They mention, by the way, they are very simple in the scenario. So they wrote because of deterioration, patient went into coma. That's it. And this is what you will deliver to the patient or the surrogate.
yeah.
Your
And
mother
also,
condition
Dr.
deteriorated.
Muhi, Sorry, Dr. Bassem. Also,
Yes.
Dr. Mahi, I also explained to her some medical things because I told stroke can happen in different areas in the brain, but in your mother's situation, it happened in the area of awareness. That's why it affected the awareness of your mother, and she went into coma. Yeah, I think this simple explanation is
By
enough.
the way, Dr. Salma, you can say even the sequelae of the stroke, sometimes it will lead to coma. It's not only for the center. No need to
Not
go.
only
Yeah,
further. Yeah,
any stroke.
I
By the way, it might be extended more, or the thrombus or the blood clot extended more. The effect of the clot extended more. So
yes.
either to give explanation or to say this is a sequelae of the stroke. No need to guess what happened there. No need to explain. It might be edema. By the way, if you invented something and not mentioned in the scenario, it will harm your marks. The opposite
Yes,
side.
I
Yeah, you
felt
are
like that when I explained. Yeah,
exactly.
but Dr. Ayat is saying that the repeated scan show that there is no interval. Yes, they want, I think, to make you understand that it's not bleeding from the aspirin.
Exactly, yes.
Yeah.
But also not written as no CT repeated here, right? The
repeated.
CT
No,
to roll
there is
out.
CT repeated.
السلام
Really?
عليكم.
Sorry. Alaikum assalam
Repeated
wa
to
rahmatullah.
exclude hemorrhage only, not to give more
دكتور
data.
باسم كيف
Why
الحال؟
patient
I
relief.
think it is for
And
follow-up,
Dr.
not
Bassem,
Yes.
I take this scenario
Yeah.
one
Yeah.
time many years back, and the surrogate was very angry with me, and he asked me, "What are you doing? Only giving aspirin? You are a doctor and a team managing my mom. What they did? Only giving aspirin like this.
Yeah.
Why she deteriorated? Where was you?
Yes.
What is your action?"
Yes. I agree.
أنا بقى
Yes.
سكت خالص وما عرفتش أجاوب.
So
that was
it
real
depends.
exam or meeting.
Yeah,
Sorry
real
for that.
exam. I think it was real case, right, Dr. Mahi?
لا مش
Yeah.
ده كان سيناريو برضه في أنا مش
Okay.
بتاع سلوك أصلا.
Yeah.
بس
By the
كده
way,
يعني.
in the exam, really, any shouting from the surrogate, you'll be quiet and you'll be hesitant what to answer. So it depends on your practice and your confidence from the practice. If you face such surrogate, angry surrogate in any training session, so you'll be able to address and to let him shut up. Really, if you can do it in the training, you will do it in the exam, but in polite way. You got it? So you will answer him scientifically, simply, without using jargon, and with confident way. But if you are already hesitant in your practice, believe me, if he shout once, you will lose all the confidence and you cannot answer anything. That's why we are encouraging for practice, practice, practice. You will face a lot of scenarios, you will face a lot of kinds of surrogate, so you will know how to address the concern, you will know how to answer him, even if he shouted at you. Clear?
Clear, Dr. Basim. Thank
Okay,
you.
the last thing advice also for Dr. Salma, when you introduce yourself, confirm the patient name and age. You explain or you introduce yourself, you ask about the patient daughter name, but you didn't ask about the age of the mother. That's why Dr. Ahmed also corrected for you, and he
Yeah.
told you her age is 55. Yeah,
Thank
this is
you.
my, yeah. The CT, yes, I read now the CT, it was written that no interval change means not every CT will show you the deterioration or but there is no bleeding, which is not related to aspirin. So you can say it's not related to the aspirin, it's related to the sequelae of the blood clot or the
Yes.
stroke. Yeah. I think this is regarding the various scenario. Anyone has suggestion or comment? Just some empathy, Dr. Mustafa. Dr. Mayada. Okay, just some empathy, check understanding, yes, scenario. So someone, yeah, Dr. Tuta asked for scenario, but the repeated CT scan roll out in interval image, ABS. Okay, I mean they repeated the CT scan. Yes, they repeated. Okay. Always give a chance to a surrogate to talk, Dr. Salma, and by letting him talking, he will give you a lot of concern. By answering his concern, you will get the marks.
Okay.
Yeah, even if you will be quiet during the station, it's okay. You will feel yourself like quiet, better than feeling yourself talk through all the scenario, but you didn't let him talk, and you might miss a lot of concern. So better to let him talk, listen to him, be good listener. It's a good comment to hear about good listener. It will give you more marks.
Okay.
Okay. So your scenario, Dr. Ahmed, patient name is Adiemi, 25 years old. The problem, discuss new diagnosis of tuberculosis. Your role, you are the doctor in the respiratory ward. Scenario, Miss Ademi, lady from Nigeria, living in UK for the last 4 years. She works as a carer in in okay, in a home, or maybe carer for someone. She presented with weight loss and fever, hemoptysis, X-ray and blood tests, sputum. Culture shown she has AFB, acid fast bacilli, smear positive tuberculosis. When did HIV testing? Patient HIV tests also came as positive. Now you are here to discuss the treatment and management plan. Task: explain the new diagnosis of tuberculosis to the patient, contact tracing, management, and address other concerns. 2 minutes, Dr. Ahmed, then we can start.
Okay, Dr. Basman.
Any suggestion from others about the previous topic? Any question? Any doubt? Dr. Aisha, any feedback about previous scenario? Any comment?
لا كفيتهم. Thank you.
دكتور باسم ممكن نسأل حضرتك سؤال على ما يجهز
Sure,
السيناريو؟
yes.
بالنسبة للعيان اللي هو العيان الطيار ده، البايلوت اللي هو كان جاله سبونتينيوس نيموثوركس ده،
Yeah,
انا بس ما سمعتش السيناريو ده قبل كده. كنت بسأل اللي هو
okay.
عايز يرجع الشغل تاني وما يقولش للفريق بتاع العمل.
Yes, okay.
آه،
Okay. Yeah, you want to do it or you want me to answer it?
لا كنت عايزك بس تجاوب لي على الحتة ديت
Okay.
انه
Okay. Our duty is to encourage the patient to deliver this news or to provide a report for his company. So it's something need to be delivered or disclosed. We cannot hide. Okay. So what we have to do, or what we are encouraging to do, encourage him to tell the company by himself. But if he's insisting, or he's insisting, yes, to hide, no, it's not accepted. We are legally bound to give you a fitness paper, and we cannot give you this paper because he will tell you, give me a doctor fitness paper, let me fly. This is my wish, and I want to fly, and everything will be fine. No, we are legally bounded. Oh, if you do so, it will harm yourself, and it might harm others. And you are in sensitive position, like pilot. You have a lot of passenger. You will put them at risk, and you will endanger their lives. So it's not allowed. Okay.
not allowed to travel again.
Yes, of course. He should be allowed by the respiratory team to have fitness paper to be back to his job. And according to the airlines rules, every company have their rules, either to resume the flying after 6 weeks, which is this is the guidelines, 6 weeks. This is for the first spontaneous pneumothorax. But for the recurrent, they should do a pleurectomy and to be reviewed again by the pulmonologist or the thoracic surgeon.
بلوروكتومي أو بلوروديسيس صح؟
Oh yes,
ولا
yes. For recurrent pneumothoraces should be repaired or periodictomy or any surgical intervention to prevent the the pneumothorax again. So just to for recap, if he asks you when to resume the job, it's per guidelines. For first time, 6 weeks, supposed to be 6 weeks. This is what also we reviewed in the guidelines. But if you are not sure and you want to be safe, we will refer you to the airlines rules. They will address that and they will let you fly again when your condition suitable to fly.
This is the condition if he is not a pilot, right?
No, if he's a pilot,
Uh, you said
six
before if
week,
he's a pilot, 6 weeks. You mean
yes.
first week or first 6 weeks?
No, no. After 6 weeks, he can fly.
Okay.
You mean 2 weeks for flying? This is for the passenger.
For passenger, okay.
Yeah, 2 weeks
Pilot
for the
6 weeks.
passenger. Yes.
Mhm.
But if he has recurrent pneumothoraces, he should review the surgeon, and after doing repair or periodictomy or whatever the management, after that he might fly. And also he has duration will be addressed by his airlines.
Mm.
But if you are in doubt about duration, you can refer him to the aviation regulation, which is airlines guidelines, and they will address his duration when he can fly back. But I believe with the multiple practice, 6 weeks is the one for every pneumothorax with the pilot. I mean, okay, this is the least duration he can wait till he can fly. For the point of I can fly without telling my company, we are sorry, we cannot do so. It's harmful for yourself and for others as you have a sensitive job or position. You can harm others or you put the messenger in danger situation if you fly in this situation. So the best way is to refer him to the airlines, and if he asks for fitness paper, tell him I cannot provide you the paper unless you are following the rules. Clear?
Yeah, doctor. Yeah, this is
Yes,
for
yeah,
the
it is.
airlines or good evening, doctor. How are you?
Yeah, Doctor, yes, fine, alhamdulillah.
Mm. Aviation authority will send him to the aviation authority or the
Yes, yeah,
airline doctor.
authorities. The same,
Yeah,
they are the same. Aviation
same.
authority or
Okay.
the airlines, yeah, they are the same. And by
Okay.
the way, they are not allowing him to fly unless he has a paper from medical reports or medical paper from the physician that he's
Yes.
fit to fly. And who can
Yes. Yes.
provide this? The
Occupational doctor.
exactly,
Ab-
yeah.
Yes.
And every airlines has a rule, either six
Yeah.
weeks or maybe 2 months, according to the
Mm.
airline. Some airlines will they restrict him for 6 weeks.
Mm-hmm.
Other airlines they can allow him after 2 months. So it
Mm-hmm.
depends on the airline's rules. But from the doctor side, he will refer him
At
to
least
the
6 weeks.
at least 6 weeks. Exactly.
Yes.
Perfect.
Yes. Thank you, doctor. Thank you.
Most welcome. Yes. Clear now, Dr. Mahi?
Yes, sir. Thank you. جزاك الله خير.
Yeah, okay. Let's start, Dr. Ahmed. Ready?
Yes, I'm ready, doctor.
Okay, here you go.
Okay, hello, I'm Dr. Ahmed from the medical department. Can I confirm you are Mrs.
Adimi.
Adimi,
Yes.
25 years old?
Yes, I am.
Okay, Mrs. Adimi, I'm here today to talk with you about your condition. Are you okay with that?
Yes, of course, doctor.
Okay. Um, can you know about what you know about your condition, if you are okay with that?
Yes, doctor. I actually came here because I was having some symptoms Like I was having some high temperatures and I was coughing out blood and I lost a lot of weight. And they did some tests for me. And I'm very concerned and I'm waiting for the results.
I appreciate your concern, Mrs. Alimi, and
Thank you.
we are here to talk about the results today. Um, Actually, the results of your blood tests and imaging have been released, and
Hmm.
I'm very sorry to tell you, unfortunately, that they are not as we hope.
Oh, what do you mean, doctor? What do you mean by that?
Actually, the results have been released, and they are showing that you have a condition. It's called tuberculosis.
Ah, okay, so it's not cancer.
I appreciate your concern, Mrs. Admi. This is the condition. I would explain it to you if you are okay with that. Uh,
Yes, of course, doctor.
okay. This condition of tuberculosis, it is a bug infection in your lung that
Mm-hmm.
may come with symptoms like coughing blood or like fever, high temperature, or some sweating during the night. This is a serious disease, unfortunately. I'm so sorry to deliver you this bad news today.
Thank you, doctor. But I am actually happy because I was expecting cancer. So if it is a bug infection, uh, that would be a good news for me.
I appreciate your concerns about me. This bug infection, it has treatment, and we will refer you to a multidisciplinary team uh, involving lung doctor, and we will also start treatment for it by antibiotics or anti-tuberculosis medications. Uh, but also to make sure you understand this disease is serious and compliance on the medication is highly advisable, as any non-compliance with the medication may cause some serious complications and may unfortunately proceed to your lung failure.
Oh, doctor, don't worry about that. I'm going to be compliant. Just give me the medication and let me take this good news to my mother. She's waiting in the house.
Okay, Mrs. Adami, I want also to let you know that we will notify the health services regarding your condition, as this condition is highly infectious to other people, and for your safety and uh, for your safety and safety for others, you should be isolated.
What do you mean, doctor? Isolated?
By means of isolation, I mean that you should be in the first few weeks of treatment with this bug infection, as it is very highly infectious. You should be isolated either at home or at hospital. If you can be isolated at home, and if the circumstances at home is sufficient for isolation, you can be isolated at home, but only in one room without being infectious to others. Or the other option is to be isolated here in the hospital to give you the full care and support in the first few weeks of your uh, condition. Are you okay with that?
Yes, of course, I'm okay with that. If you are allowing me to go home and to be isolated in my home, that would be very good because I have also a son there, and my mother cannot take care of my son. So no problem.
Okay, I think uh, i- um, regarding your son, this disease is highly infectious and it can be transmitted to your son very uh, fast. It is transmitted by droplet infection or by only breathing. So your son may, with his low immunity, may catch the disease faster.
Mhm.
So regarding isolation, it means to be in the hospital if you don't mind. If you can be isolated at home, okay.
Yeah, doctor, we agreed that I will be isolated at home. And regarding my son, I will wear a mask.
Okay, let us arrange another meeting with my consultant uh, in order to let you maybe think more about this isolation because, as I told you, this condition may be serious
Doctor,
and
doctor, why I will meet your consultant? Because we are in the same page. You are saying that it's okay to be isolated at home if the circumstances allowed. And you say that if I have a room, I have a room, and I will be isolated at my home. I will be wearing the mask all the time.
okay.
So, is there any problem in this situation?
No, there is no problem if you are at home, isolated in one room for the first few weeks after taking your medication.
Okay.
Okay. Also, I'm so sorry to let you know that uh, we have done a blood test for HIV, and I'm so sorry to tell you that the results has been positive also.
HIV is, are you saying that I'm having AIDS?
I'm so sorry to deliver this bad news today to you, and I appreciate your feelings.
Oh my God, doctor, that is very devastating. So, um, what are you going to do for me?
Okay, we will involve multidisciplinary team involving uh, the specialized team uh, for HIV
2 minutes
also
left.
infectious team. And we also will screen for any direct contacts that you have been with to give them prophylaxis against this condition, which is tuberculosis. We will actually start by giving you the anti-tuberculosis medication that I told you. This is long treatment, which may involve up to 6 months or maybe more. Uh, these medications have some side effects that you should be aware of, and we will give you leaflets
Yeah,
regarding that.
doctor, are you talking about the treatment of tuberculosis?
Yes, Mrs. Arimi, we are starting with only the anti-tuberculosis medication because giving both the treatment for HIV and the treatment for tuberculosis with each other consecutively um, is not our cornerstone of management. We must give first the anti-tuberculosis, and then we will start the HIV medication after that, if you are okay with that.
But isn't HIV more serious than tuberculosis?
Yes, Mrs. Adami, I understand, but giving the HIV medication may actually uh, make the bug uh, more advanced and more complicated in the long. Do you have any concerns, Mrs. Adami?
Yes, doctor. What about my job?
Mhm. Uh, I'm sorry. We will involve the occupational health worker regarding your job, and they will help you regarding that.
No, can I resume my job after this isolation? You said for 2 weeks or something, isolation. Then can I go back for my work? Because
Uh,
I'm totally
yes, we will
dependent
just
on
make
this.
sure that your phlegm is free from the bug and no bugs released to be infectious to others. And after this time of isolation, you can resume your work if you are compliant on your medication.
Doctor, from where do you think that I get this tuberculosis?
Mm. Do you have any travel history recently?
No, I've been in UK for the last 4 years. I didn't. I came actually from Nigeria. I'm originally from there, but I didn't leave UK in the past 4 years.
And have you been in contact with any ill person recently?
Yes, of course. I'm working with the ill people because I'm a carrier. So I'm taking care of sick people. Do you think that I got it from them?
Uh, it is one of the probable places that you have may catch the disease from, but we will keep direct contact with them and screen for them and give them prophylaxis. And also, we will notify the healthcare services regarding this.
Okay.
Okay. Time is up or exceeded by 2 minutes.
2 minutes also.
Yes. Dr. Salma will comment, then I will comment.
Okay. So you've introduced yourself and you confirm the patient ID, and you ask about how much she knows about her condition, but I didn't hear you asking about her expectations.
Mhm.
Uh, then you break the news of tuberculosis like breaking bad news. It's a disease counseling because the disease is curable. So you don't need to give I think from what I heard from other mentors that you just need to tell her that these results are here with you, and it revealed that she has a bug infection in her chest called tuberculosis. Have you ever heard about it? Do you want me to explain more about it and then explain TB? And
Sorry, what have I done extra?
yeah.
You mean if it is not curable, what should I have done?
If it is a non-curable like
Mm-hmm.
cancer, like this, you will give the golden silent, the warning shot that I have the result here and it's not like we hoped, and you prepare her for the bad news. But
Mm-hmm.
now you prepared her for the bad news. She was thinking that it's cancer. When you said that it's a bug infection, she was feeling relieved. So I heard from the mentor that the surrogate did the candidate did the same. She break the tuberculosis like a bad news, and the mentor told her that no, you just tell her that she's having tuberculosis without the warning shot and etc.
Dr.
That's from
Salma,
what I heard. Yeah.
yeah, but I believe if HIV is there, should be as breaking bad news.
I will just shock you that they said that HIV is not your task. Actually, you are the senior, the doctor in the respiratory clinic, and HIV should be mentioned in the last. It's not very important now. The very important task now is tuberculosis. I need your opinion also in this point.
What do you mean? You mean because my role is in respiratory ward and the patient is
Yeah,
coming with
and
TB, so it is TB
it
lung?
is written clearly in your scenario.
Mm.
Your role is to discuss the new diagnosis of tuberculosis. And in the end, you will tell her that she has got HIV also. And the HIV is you will explain the HIV, and you will explain that we will not start the management now, and we will reschedule another meeting with you to discuss further about this HIV. But what is concerning us more now is the
The TB.
tuberculosis, and we need to start the management of tuberculosis first. The HIV, we will reschedule another meeting to discuss everything about HIV. The other thing that isolation should be in the hospital, and they said that mentor said also in UK. I don't know Dr. Maida if she's here also to confirm this. It is uh, it is mandatory and legally bound that they will detain the patient if she refused to be isolated in the
Yes,
hospital.
yes, I believe. That's why at the end
Yeah.
I said another meeting with my consultant that because I know that this patient couldn't go
Mm-hmm.
home at any if he refused isolation or you suspected that he refused to be isolated at home, he should be
Mhm.
detained under the medical law.
Yeah, the thing that you should not mention home
Yeah,
Hmm.
you should
in the
start in
beginning.
hospital. I agree with
You
this.
yeah,
You
you
wait
should
for
not.
him if he started it, but you should not
Yeah,
mention it,
If she
right?
should
I
negotiate with you, that time only you can tell her there is in some occasion, we
Hmm.
can let you go home. Some occasion, not as if initially.
yeah, I will
Okay.
tell you, Dr. Ahmed, how the scenario is supposed to go. When you are telling her that, the first thing you have to tell her that we need to isolate you because after
Exactly.
explaining the disease, you will explain that it's a bug infection and it is highly infectious and it is spread by breathing, droplets or breathing, so by air. Because of that, tuberculosis, the patient who's got this type of tuberculosis need to be isolated in the hospital until the phlegm, the test in the phlegm came positive, and that actually would take some weeks. Then you will mention like this.
Until becoming
You
negative,
will
you
never,
mean?
yeah, and until it became negative, yes,
Hmm.
and this normally will take some weeks. Then
Hmm.
after that, she will tell you, what if I can be isolated at my home? You will ask her, can I know why you don't want to be isolated in the hospital? You explore why she want to go home. Then she will tell you that because I have a son. I need to take care of my son. You will ask her, don't you have any other member of the family who can take care of your son while you are in the hospital? Then she will tell you, I have only my mother and she is old and sick. So she gave you the reasons in your hand.
The
You
reason.
will
So
use
you
these
will.
reasons like weapons. Yes.
Mhm.
You will tell her, so in your house you have a child and an elderly person. These people actually, or this category of persons, they are the most people who can get the infection from you. You can spread this to your mother and your child. And that's another reason why you need to be isolated in the hospital. I think that you don't want to give this infection to your beloved ones.
Mhm.
So you will be more convincing like this. Uh, I don't believe that she will negotiate after that because you touched her beloved people. But if she did, then you will tell her, I'm sorry, I don't, I actually don't want our discussion to reach this point. But I'm sorry to tell you that we are legally bound to keep you in the hospital in this isolation period because
But this is confrontation, I think.
uh, yeah, but that's why you will say it like this. I
No,
actually
no, I
don't
mean
want to
this is
open
kind of
this.
confrontation. You shouldn't make this, I think.
What
Uh,
I hear, Dr. Salma, in
mhm.
UK also, they sometimes they give the chance to isolate the people at home if under certain, of course, occasion and circumstances. Why?
Yes, that is
Because
true. If she is living alone, if she told
exactly,
you that
yeah,
I am living, but she already told you I am going back to home to my son and
but
my
she
mother.
has a single room, which might be also fit for isolation. What I mean, it's don't detain her. You can give
Yes,
her the option.
exactly.
Yeah, you
Mm-hmm.
start as initially as the option of isolation at hospital, and this is the best way. 2 weeks only, you will receive the treatment. After you will be negative, you will be back at home, and your family will be safe of this infection. If she negotiate and she try to argue with you, no, doctor, I cannot leave my mother, my kid. Try to convince her about their lives and their health. If still, you can tell her in certain circumstances, we can let the patient go home, but in one occasion, if he has single room with single bathroom, and he can stay away from the family by wearing mask, and the room will be good ventilated, but as a second
Mm-hmm.
option, not as a
Mhm.
first
Okay.
option. Okay?
I also saw some mentors
Yeah.
involving to say that we can involve someone from the community services to take care of your child until this period of isolation ended. Don't know if this is
social service, yes.
mhm,
And I think the solution for this debate, that in the end we can tell her that we are going to involve the Department of
IBC.
Bug Infection, and they will have a meeting with you and with my consultant also. They might convince you, or they might make you look at this situation from another perspective. And just don't agree for her in the end, just because we are not sure. I hear that from someone working in UK, and you hear that from other mentors also, so we are not sure. um, so in this situation, I am always taking the diplomatic way.
Yes,
I'm not
doctor.
going
You
to
are,
tell her, I'm not going to tell her go home. I'm not going to tell her yes we are agree. I'm going to tell her
the
we
last
are
thing
going
to
to meet
say is
another meeting.
yes,
Yes.
another meeting. That's
Yeah.
what I was
Yeah.
gonna say.
And that would
yeah,
be the
but
end of the discussion. Yes. Yes. The
so
most important other thing, which is very important, to explain to her the management plan. So, if you allow me, I would like to explain to you the management plan further. You are going to be given multiple types of medications. These are like specific antibiotics to treat this bug infection. You are going to take them orally for a long time. You are going to take two type of tablets in the first 2 months, and the other ones in the
Other 4 months.
in other 4 months. So these medications, very important to be compliant on taking them, and we are going to follow you up even after discharge from the hospital with regular follow-ups to make sure about that. And like every medication has some unwanted effects, like Dr. Basim said. One of them, they might affect the liver. That's why your liver. That's why we need to be in close contact with you and monitor you to interfere at any time you need that. And also, uh, of course, you need to mention the group of doctors. This is the management plan. So your agenda would be isolation, management, explaining the disease, isolation, and then management plan. And the fourth one is tracing contact. Okay. And then in the end, you will tell her, I believe that you did another test. I believe that you are aware about that test. It's about HIV. And I'm so sorry to tell you that this test result also came positive. Give her time to react, and then you tell her that we are going to rearrange another meeting, because the HIV is a very important topic, and we will discuss further about that. Because in HIV, you need to ask about sexual life, partners. Um,
Mm.
uh,
Time is up. Actually, we have
yeah,
discussed the isolation thing for around 3 to 4 minutes, and that's why time
yeah.
is up early.
Yeah, and that would be the situation in the examination, in the exam also. You will not have
Mhm.
time for HIV, but the most important thing to advise her for safe sex. This is the most important, because she might go.
She might
Yeah,
infect others.
yeah.
And I would screen contacts of HIV or something like that in
You would have
Yes.
another meeting for HIV. I don't know if the most important that you have a partner. Are you sexually active? Yes. Do you practice safe sex? If yes, okay. If no, I advise you to do to not to practice sex now. But if you will do that, it should be a safe sex. That's
Mhm.
it. I don't believe that you will have time for that.
Yeah, I think it's a
Yeah.
complicated scenario. It's long,
Yeah.
need long time to explain and to address all concerns. That's
Mm,
why they will put some specific concern in this scenario to cover them, either to be raised by the surrogate or to
mm,
be raised in the scenario itself. And I believe the scenario is getting different in the details. So
mm,
they will change the details of the scenario from center to center, from diet to diet. In this scenario, I believe the HIV and any infectious disease scenario, you have to assure about confidentiality. This is what I believe also in the beginning. Once you introduce yourself, I reassure you this meeting will be confidential. Why? Because you are going to deliver sensitive informations, which is HIV, which can be transferred from sick person, from maybe sexual contacts. So it should be assured. It would be confidential meeting. This is what I prefer to do whenever I have suicidal thought or HIV or any sexual transmitted disease. This is and as introduction. I believe also, and I prefer to do the breaking bad news in both as initial and together. The result came as we don't hope. What you mean, doctor? It came positive for two disease. I'm so sorry to say, you have tuberculosis and you have HIV. Then
To
let's
save time.
yes, to save time. This is my opinion. Also, if I don't know if some mentors will prefer to do in another way, but to save time, do it once, and as also breaking bad news. Even
Yeah, that
TB is curable.
that was my opinion also, Dr. Basim,
Yeah,
before
but
yeah.
exactly. The
Mhm.
mentors are not examiners, by the way, so they can give effort and they can do their effort for explaining, but they don't have any guarantee the examiner will guide or will judge you according to their wish. Believe me, you have some examiner very stupid. They will judge you and they will judge on your performance regardless your mentor. The most important thing to cover what he wants to hear from you. Let's go back to the breaking bad news. Even the TB for me is breaking bad news. Why? Imagine you are telling about respiratory failure, you are telling about lung scarring or fibrosis, and there is people nowadays living with fibrosis because of TB, because of non-compliance to medication, for example. Plus, the long-term medication. Imagine the patient will take the medication for maybe 6 months. If there is some resistance, it might be extended to 12 months. Is it good news? I don't think. If you're gonna take medication for 5 days, if you have flu, you will feel like upset. Oh my God, I will take Augmentin for 5 days, Q2, 12 hours, for example, day and night. It's upset, right? It's something annoying. Imagine 6 months. When I take rifampicin, they told me, in, as a healthcare worker, they told me I should take because of latent TB. They provide for me rifampicin for 3 months, right? Or maybe 4 months. I was so much annoyed. Oh my God, I will take it every day and I will notice some change of the color of the saliva or of the water work. Yeah, it happened and it was annoying me. Imagine the sick people with TB. Is it good news? I don't think it's curable one. Is it? It's not bad news. I believe it should be as breaking bad news.
The
Anyway,
problem here, Dr. Bassem, that she said I suspect to be cancer because they
yeah,
said to her it is something wrong in the
ex
scan. So if she suspects it is a cancer, the TB will be not that bad news that deliver with silence and the
Exactly.
same sequence.
Exactly.
It is bad news,
Yes.
but not as drama as cancer. They said like that when they comment. And when I hear from mentors, not to deliver it as a cancer because you will scare the patient, and this is not
Yes.
a very uh, not
Mm,
end life or not cancer, not any something.
okay, but
They mean like that, not
being
making golden silence. Don't
But also you must
offer
address the compliance of that drug.
maybe, but
the
this is the
HIV here,
point.
maybe the
Mhm.
HIV here also give you the way to talk about breaking bad news. Anyway, we'll not argue about that. If someone has a comment or feedback about this scenario, particularly about saying this in this
Yes,
way,
we need
uh,
that. Mhm.
yeah, please, anyone has it, share it with us. This is thing. Another thing, Dr. Ahmed, when she told you, doctor, it's not a cancer, you have to
Mm-hmm.
answer this concern. It's one of the concern.
Yes.
If she told you,
Yes.
doctor, it's not a cancer, doctor, right? You didn't tell her, no, it's a cancer, or yes, it is a cancer. You have to address yes or no.
Mm.
Okay. You just say here,
Answer
you
the
just
concern first,
yeah,
and then
exactly,
the explanation.
exactly. Tell her, I appreciate your concern. I appreciate your worry about your condition. Yeah, it's quite stressed to hear about that, but it's not a cancer. That's it.
Okay.
Then jump to the next topic, which is the TB. Explain the TB, explain the HIV, which, as I said, to be together, but explain one by one the disease, the TB first, and you should notify. TB, of course, one of the notifiable disease. HIV is not. So you will talk about notification. I wrote the topics and the point to
Yeah.
be mentioned in the chat box. So the notification first and contact tracing, of course. When she told you my mother is sick, I will, yes, we should also have a look to your mother. It's one of the welfare points to have a look to her mother, why she's sick. Maybe she is the one either give her the TB or she contracted the TB from here. So you have,
Yes.
How should I ask for that?
Yeah,
not
I
as a
was about
question.
to comment about that actually,
Yeah.
that you need to, yeah, you need to say anything. Even
Yes,
I'm
exactly.
so sorry for your mother,
Exactly.
and please you can bring her. We need to take a look. And this is
Okay.
also contact tracing, because she was in close contact with her mother and her son. So we need to see what is going on with
Exactly.
them. The other thing also, when I told you, do you mean that I have AIDS? You need to take the opportunity to
Yes.
differentiate between HIV and AIDS. You need to tell her that HIV is when you have the infection in your blood, the bug infection, and the HIV itself. But AIDS is a different thing. This is when your condition deteriorated and it affects your the organs in your body. Now you are not in this situation. Yeah, now you are not in this situation, and actually starting the management of HIV is not by now. It's not urgently now. We need to do further tests for you, because you need to check her CD4,
And her
the
HIV
viral
count.
load, a lot of tests. So we need to check your your HIV situation now, to evaluate you further, and then we will decide the management plan. The most urgent thing now is to start management for your tuberculosis. Okay, that's very important. And you tell her that also a lot of people carrying HIV in their blood by some medication and regular follow up and lifestyle modification, they are living near normal life. So we are going to discuss this further with you in another meeting. But the urgent thing now is to discuss about the tuberculosis management and to start the management, by the way.
تخيلي يا دكتورة سلمى إنه نفس
Mhm.
السيناريو جانا في الامتحان وبعدين the surrogate raised the concern that when I will receive medication for the HIV.
Yeah, we
Yeah,
answered this
this
concern.
depend on the test and the re-evaluation for your HIV
Test already
condition.
came positive. The test already came positive.
Yeah,
No,
yeah.
no, not that test. You need to do the CD4 count and the viral load, and
I ask
Dr.
about this
Salma, we
point.
discussed,
One
yes,
is
we discussed
consultant
this topic last
infection.
week. Yeah.
Mhm.
Yeah, yeah. I ask about this point after we discuss. Yes, they may wait for even 3 months if the
Yeah,
CD4
eight
is
eight
good.
weeks plus, 8 weeks plus.
Yes.
Yes,
If it
yes.
is less than 50, they wait only 2 weeks, like that.
Mhm.
If it is more than 50, the CD4, they can wait for,
Mhm.
he said to me, we can wait for 3 months to start, because
In 3 months. Yeah.
they making focus about the side effect and the interaction between the
Mhm.
Mhm.
HIV and the TB medication. So they making more important to eradicate the TB than, because HIV it is long term. He will take, and if he's stable, they not in hurry to start the medication for it.
The medication, yes.
Mhm. Perfect. Okay. Thank you, Dr. Aisha, for this thing, because we discussed this question and topic last week. It was the same scenario, by the way. And we raised this question, will she start the anti-TB first or the anti-HIV, or together along with each other? But now the answer is clear. So we'll start with the anti-TB for certain months or weeks, and you will be followed up with our team to decide when to start the medication for HIV. and in the best interest of your condition, we will tell you in the appropriate time to start the medication for HIV. No need to mention 3 weeks or 3 months, but you initially start anti-TB, then later on you will cover the anti-HIV. Okay. Back to the other comment. The topic I wrote here in the point. Yes, the isolation we mentioned. The jargon, Dr. Ahmed, you mentioned a lot of jargons. So try to train how to avoid the jargons.
Okay.
Yeah, with the
What
practice.
about history?
Yeah, I wrote history. Not allowed to
What?
take history. If she told you as she told you in the scenario from where I got, you can guess, but don't ask. How to guess by her job? You can tell her some jobs carries the risk to catch the infection from others. She will tell yes. She will tell you yes, doctor. I am a carer. So this is the reason. For example, or she will tell her.
Yeah, Dr. Bassem, excuse me, just before you continue answering this question, yes, you can answer in a very short sentence that tuberculosis can be contacted from others if they carry it. So maybe you contacted from any other person who was sick. The other thing that tuberculosis might be there in your body but sleeping. So you have it, but then when your immunity coming down, like when you are having HIV now, this sleepy tuberculosis might be activated and start giving you the symptoms that you have. So these are two ways why or from where you got the TB now. Either you contacted newly from other people who were sick, or either it was in your, because she's from Nigeria, maybe she has it before, and but don't mention that to her. Okay, because
Don't
you will
mention what? Sorry.
don't mention that because she is from Nigeria. Don't they
Okay.
put it in the scenario that
To tell
she's
her
from
that your
Nigeria.
country is
They
endemic,
they
yes.
want you to touch it. Yeah, if you touch it, you will be in trouble because you will be judgmental like this. So just it might be in your blood already, but sleepy, and then when your immunity coming down, it will be activated and start giving you the symptoms that you have. So by this way, you will tell her that either from then she might then tell you or in the scenario it is written that she's a carrier. If you understand her job from the beginning, you can tell her, I understand that from the notes that you are working as a carrier. So you are working with a lot of sick people. You might contract it from any sick people that they are carrying the tuberculosis already. Like this, you already explained her concern.
Yes, exactly. But never ever take history or tell her, did you travel here or there? Did you have a contact with sick patient? Did you have family history of something? Yeah, it's not allowed to take
Not
history, and
allowed.
it's a big notify there in the paper. History is not allowed to be taken. So take care of this, either to mention as a cause or example. So, for example, you can catch it from someone sick you didn't know about him, or maybe some patient will get it from sick people who's taking care of them. Some occupational positions or jobs maybe having the risk to get this virus, like some scenarios coming as a nurse, by the way. So you can give the example without specifying it to there or to her.
And if you don't found anything, you can tell her
She
that it is.
she will
Uh,
tell you. She will tell you if something related to your talk. She will tell you, yes, doctor, I was taking care of my uncle and he was sick. Yeah, yeah. So you can say to her, I guess maybe this is the reason, or it might be another reason from your job, but it will not be as a
يقول لا I
clear.
don't know خلاص. يقول لا I don't know خلاص.
The easiest
أنا
thing
عارف خلاص.
for the
and one
clinical
question,
judgment.
please.
Yes, Dr. Ahmed. Yes,
Regarding the specialized team, which
yes.
team should I refer this
Infection
participant to?
control here. Infection control on the top of them.
Mm-hmm.
Infectious disease and lung doctor, and also respiratory therapist or yeah, respiratory therapist. Okay, of course, clinical pharmacist explaining the medication, the side effects, dietitian as well, because also you are giving medication. It might need to be careful about the interaction with the food and so on. So these things should be covered. By the way, alcohol and smoking should be addressed in this scenario, of course, if you have time, because the smoking will harm the lungs more than the TB, or along with the TB, I mean. And the alcohol, of course, as an interaction with the medication, as inducer or inhibitor. So it might be also addressed. The job, I believe, don't ask what's your job, because it's written in the scenario. And once it was written in the scenario, if you ask it, they can take it as negative feedback. You are not focusing in the information. So you can tell her, I believe you are a carer. I read in your notes you are a carer. I guess it's impacting your job. She will tell you, yes, doctor, of course. You'll tell her, we will address this. We'll give you sick leave until you'll be clean or clear from this infection. You might experience your job later on if you are clear. Okay?
And the scenario will be with you while you are talking to the
No,
servant?
no. You will take the scenario outside, okay?
Okay.
The room. You will write whatever you want to write. You can
You
write
have
all
an
the scenario.
A4 page.
5
You have
minutes.
an A4 paper. You can write the whole scenario.
A4
Okay.
paper. You whatever you want to write, write. You can put a scheme. You can make the arrows. You can make draw figures. But once you enter inside, you will not take the scenario. So what you will take? You'll take your paper. You can look at your paper once or twice or thrice during the discussion to pick up what you want to talk about, and to give a clue for yourself what I should stress on, what I should do, what I shouldn't do. While the job here, you can write it in a circle, for example, as a job occupational thing you have to address. It is the thing for her infection. Plus, she shouldn't do her job unless she is clear from the infection. Why? Because she might infect others, because she's taking care of sick people or elderly people.
Okay. And should I address the time specific 2 weeks, or I should tell her that we will
Isolation,
inform?
no,
Tell me.
isolation for every guidelines, 2 weeks taking the medication. They are repeating the AFB. If it is negative, they can they can be out of isolation. This is for any guidelines. I don't think it's something to be not to be mentioned. I believe for all, right, Dr. Aisha? So I can tell no, 2 weeks
Yes,
isolation.
because there is some resistant strain, so
Sorry,
we
Dr.
not
Aisha, we cannot hear you well.
it can't
Hello, doctor.
Yes, Dr. Yasser.
Because
Regarding
the
the
some
isolation place, na, the guideline says actually it depends on the condition. If it is multi-drug resistant TB or the serious condition, it
Yeah,
should be
yeah.
isolated at home, like a hospital. If like she can take the medicines at home, and you can make the isolations at home also.
Yes, it's depends
Depends on the
on the
condition, TB severity of the
exact
TB, doctor.
condition.
Actually,
Yeah, it will be also. Yes.
yeah, I
Yes.
checked the guideline, doctor.
Okay, thank you, Dr. Yes. So you
it
you
is
share this
according to the
guideline.
response also, Dr. Bassam, and because some strain will be
Maybe.
resistant,
Exactly,
so
resistant.
they
So
will test you after
perfect,
2 weeks and they will
perfect.
decide.
Yeah.
Yeah.
So you can give 2 weeks as initial isolation period. Later on, we will reassess you. If you are clear of this infection, you can go back, or you can be out of the isolation.
Mhm.
Okay. Yes.
I have also comment about the jargon
Yes. Sure.
because
Yeah.
yes, he
Go
should
ahead.
take care because I
Yeah.
have deducted because one word
One
chemosis
word. Oh my
and they
God.
write it for in feedback. It is something not fair, but they making
Yeah.
results.
Believe me, they search for
Even
one
if you
mistake.
explain this jargon after saying it?
Yes, they write for me. They deduct in communication. Already the two examiner write for me the point, but one deduct and one didn't deduct. Because I heard that you allow it for one jargon, it's no
Yes.
problem. After two jargon, they can deduct.
Yeah.
But they
If
deduct V for one jargon and they write it ecchymosis. Even when I
Explain it.
examine, I saw this ecchymosis and I pointed to it and asked
okay.
from what time this ecchymosis. This is the problem that I point already, so she will know what this.
I will not see the rash because I already saw
Maybe,
it and she see it. So it is
maybe,
not something not explained.
maybe this examiner had a fight with his wife earlier. That's why he wasn't in good mood. I believe the
But
examiner.
about that, we should take care because we will
Yes,
not
of
let
course,
them
we should
taking
avoid.
from us marks. Yes.
Exactly. Mistake, only single
Even
mistake.
if you make a mistake and say jargon, follow it by the explain. At that
Exactly.
time, they should not deduct anything.
Exactly. Again, single mistake, maybe the examiner will minus you the whole skill for one single mistake. Believe me. And in the same time, you might see the other examiner give you satisfactory, but his wish to minus you, so he will minus you. Unless they will sit together and after you finish your station, they will sit together
Maybe the
and
other
they will.
examiner write this. If
Ye-
I will mention another one,
Yes,
he will
they are
deduct.
reminding each other. By the way, they are reminding each
They
other.
remind us.
Yes, after, because not everyone is focusing what you did, what you are doing, what you are saying. But sometimes after you finish, they will sit together for 5 minutes, so they can do the comment together, and they will minus you
No,
in
but
both.
they are not allowed to
Who
discuss
told
the
you?
marks together after
Who told
the
you? Huh? They are sitting in the same room.
mm,
They are
the
sitting in the
guidelines on the MRCP UK
Forget the
website.
guidelines.
Forget the guidelines.
Forget the guidelines. Yeah. If you raise an appeal, they will defend on the examiner. They will say, we believe on our examiners, regardless
Mm.
the gender, regardless the nationality. So I don't think and I don't believe they are not sitting together and they are writing the comment separately.
أنا كنت عايز أسأل الدكتورة سلمى about break bad news or no, the way how she will say for any patient counseling about multiple sclerosis, Guillain-Barré, primary sclerosing cholangitis, any disease treated or have treatment or no, infection curable or no, how she will break this bad news, or she can counsel a disease without saying it is break bad news.
I believe any disease for long-term management with the relapse on
Long-term
an.
management, yes. He
Yes,
mentioned now multiple sclerosis. This is
yes, yeah, with
not
the relapse.
curable and
Exactly.
long-term. But in this situation, I believe that the expectation will help you more. If you
Yeah.
ask
What's
the
your
surrogate,
expectation?
what is
Yeah.
your expectation? He will tell you, I'm afraid that it's cancer, and you have a diagnosis of tuberculosis.
No, no, no.
Then,
I don't mean this, Dr. Salma. I mean, no need to do much drama and golden silence and like this in simple disease like celiac, مثلا. Yeah,
yeah,
this is what I understand from you. No need to put much drama, good silence. لا كأن في مصيبة واقعة على راس الراجل دلوقتي. لا أنا يعني wanted to counseling but in simple way. How you will say that?
simple.
How?
Yeah,
How?
like in this scenario of tuberculosis, I will tell the patient that what is your expectation? She will tell me her expectation. If she tell me, I'm just here to see to know the results of my test. I will tell her yes, the results of your test are here with me, and based on the symptoms and the result of came positive for a bug infection in your lung called tuberculosis. Have you ever heard about it? Do you want me to explain more about it? And go on and explain about it.
No need يعني
What
to
is the
say
problem
it is
now?
not as we
And if
hope
she
and
tell me I'm concerned that I have a cancer because I'm coughing out of blood and I lost weight. So I appreciate your concern, and yeah, the test results are here with me, and yeah, it's not a cancer.
we cancel.
I
Yes.
answered her concern, but it revealed that you have another condition called tuberculosis. Have you ever heard about it? Do you want me to explain more about it like this?
Yes. Okay. Okay, Dr. Sam. Thank you.
Okay.
Dr.
Welcome.
Nohi, I did a short video about when to break bad news. You can listen to it. It's about the condition which is For example, cancer. So cancer, of course, definitely, unless it is lymphoma or Hodgkin lymphoma, but still it's cancer. So the cancer, the progressive disease, which is progressing, progressive with the time, it will be deteriorated like motor neuron disease, like multiple sclerosis. So with the time, the patient will be deteriorated definitely, or most of the cases, and the long-term disease with long-standing disease like diabetes, it carries a lot of complication. So I believe you should break bad news in this condition, diabetes
Yeah.
and hypertension as well. Although it can be managed, but still the complication still might happen even with the management.
Yes, and also when you are breaking bad news about something like cancer, you are going to explain cancer, it's abnormal growth like so, and I'm so sorry to tell you, it's a serious disease and it's difficult to treat or incurable. Multiple sclerosis is the same. It's like so, and I'm sorry to tell you that it's incurable. So you will say this sentence in the explaining of the disease. In tuberculosis, you will tell her that you have a bug infection in your lung. It's a serious disease, but it is treatable. So you are telling her that she's having a bug infection, which is tuberculosis, which is serious, and it is treatable in the same time. So it's half news,
Yeah.
not a very bad news.
For me, I will do it as a breaking bad news. Anyway, the TB as a bug, it's not only bug. I believe you can say it's super bug because it's very aggressive if you don't treat
Granuloma.
it. Sorry.
Caseating granuloma doing fibrosis and then
Yeah,
bronchitis
so
later
it's super
on.
bug. It's not easy bug to be managed, and it has strains which is also having the resistance. So I believe it's for me breaking bad news definitely. This is for me. I don't know for maybe some mentors they will say
You
no.
can give her the breaking bad news and then reassure after it exactly
Of
immediately
yes,
that this
yeah,
condition
I
is
believe
curable.
yeah, you can do it in breaking bad news. Then you can assure her that if you are compliant to the medication and you are taking it in a regular way without stopping it, without contacting us, yeah, it's you might live near normal life. I agree with this. Yes.
Logically also, doctor, sorry, doctor, logically also it's breaking bad news.
Sorry.
Logically also, this is breaking bad news.
Uh-huh. Yeah, yeah. For me,
Yeah,
I it's
yeah,
breaking
yeah,
bad.
completely. Yes. Thank you, doctor.
Thank you, Dr. Yasser. Any comments? Any suggestion?
I noticed also in Ar-Rakh, which is the first book for communication, that when he's talking about curable disease, he's writing counseling about the disease. And when he is talking about incurable disease, he's writing breaking bad news. So I don't know. I'm confused now.
Okay, how many curable disease you have in medicine? I don't think
Today we
you,
are talking about.
But there is a scenario in Al Rukh with the TB, and
Mhm.
Al Rukh answered it with breaking bad news, and then after
Really?
it reassurance. Yes,
Uh,
it's
Yeah,
on
and
page
Actually,
in
I
all
52,
believe
group,
in a
sorry,
rock.
doctor. In all
page
group,
So
that
it's
51.
okay.
TB isolations is also mentioned both home and this hospital.
Dr. Yasser, if you want to
Yeah,
start isolation, always give the option of the hospital first.
yeah.
Because
But
if
in
you will
I
be
went through
giving
the
the
yes,
home isolation, she will be reluctant to the hospital. She will
yes,
tell you, okay, doctor,
and
give me the home
e-
isolation option.
what the guideline is saying is, if the patient requires admission, okay, for the TB condition, then it should be isolated at hospital. If the patient's condition is not to be admitted, if he can go home, isolate the patient at home. That is the guideline, doctor.
Okay. Because they want to give it space for other patients. If they have
Yes,
the good
yes,
circumstances and the good
yes.
ventilated room, so they can be
Yeah,
isolated at home.
but if the patient is ideal for the home isolations, make sure that home isolations is meets the criteria. That is important.
Yeah, exactly. Yes. The sun
Yeah.
exposure, the ventilation
Yes.
system,
Yes.
single bathroom,
Done.
along with
Yes.
the, yeah, the bathroom I mentioned. So
Yes.
ventilation. Yeah. Also, be away from any person using mask.
Persons. Yes.
Yes, exactly. All these
Thank you,
rules
doctor.
should be there. Yeah, thank you, Dr. Yes.
Thank you, doctor.
Okay. Dr. Aisha shared, yes, the jargon, but you're lucky they give you borderline by this. Some jargon they might give you unsatisfactory. However, it might also be 1 mark to pass the whole exam. So it's not a matter of 1 mark or 2 marks, because sometimes you might fail the whole exam for this mark, and you will feel injustice really if you fail the exam for 1 mark. In, for example, your situation, if this mark will pass you, you will feel injustice. In the first experience in the exam for me, 1 mark I can pass the skill of communication, and one examiner wrote for me in the end of life care scenario. He wrote for me and practiced, and he gave me borderline. This mark failed me in the whole exam. And this comment, till now, I don't know what he mean by unpractice. He didn't explain what I did. And I got 14 out of 16, unpracticed, as a comment and borderline from examiner. I think he was very tough to give me this mark.
Yes, some comments I think I
Yeah,
never
a
forget
stupid,
it.
really stupid comment. What's unpractice? Give
One
me.
comment for me for driving also advice. The other scenario, they said they didn't deliver the information in intelligent way. And till now I think about what is this
The
intelligent way.
intelligence. Yeah, iPad. You should have iPad and
Even they
give him.
deduct only 2 marks in this
Which
station. Only 2 marks.
which center is this?
Jordan, what other?
My
It
God.
is, he only deducted 2 marks for me in this scenario, and only one of them write like that comment. This comment I never forget it because I don't
Yeah,
know what he mean.
I
What
don't
is your
like.
comment? What is
Yeah,
the mistake I
I
did?
don't like the vague comments, because I will learn from this comment. You want me to learn, or just you want me to fail? This such comment means you want to fail me with no reason.
Yes, what is
Unpracticed,
this intelligent way?
intelligent
What
way.
what
I
I
don't
did
know.
wrong?
Yeah,
I don't know.
what I will use. IA, or what's by what you
I
mean by.
don't know.
I don't know, wallahi. Anyway, Alhamdulillah, and hopefully others will pass this nightmares and horrible exam. Believe me, it's a matter of luck and center wish. If you want to do it, choose the center, good center, I mean, and hopefully you can pass this exam, inshallah. Okay, the precaution of HIV, yes, Dr. Ahmed, if you have time, of course, you have to say, as Dr. Salma said, use protected sex, try to use your tools, private tools, don't share it with others. At least these two sentences or these two instructions, at least you cover the precaution. Why? The most important thing is the sex and the tools, the
For the
private
safety
tools.
of others. Yes.
Yes, that's it. That's enough and fair enough. Otherwise, yeah, try to avoid the jargon, as I said, and perfect, inshallah, you will do it.
Jargons, I said actually fever one time, and
Yeah, and
said
don't explain the symptoms. It's already there written, and she knows it. So you can mention easily. You can say the symptoms you have. She
okay.
will she will know, or she will tell you, or she will not tell you. It's written, and she knows them. What she want to know now is the result. So you will give her the result without saying the symptoms of 1, 2, 3, 4, 5. You might waste 1 minute for this result, for these symptoms, which might be important to address a concern at the end. So
Dr.
don't mention
Basim,
symptom. Yes, Dr. Sam.
I have one comment.
Yes.
I once witnessed a candidate from UK. I don't know if she's Arabic and she's speaking well
Okay.
English, or she's English, because mashallah, very well.
Okay.
So she was answering and explaining in a very short sentences.
Okay.
Very short. You cannot believe how short the
Okay.
sentences. Yeah, but she did it perfectly.
Okay.
And she passed the exam. And I noticed that we in the Arab people, we are always explaining in a very
Yeah,
long sentences.
exactly. Yes.
That's why we are falling in mistakes.
Yes. Yes. You're right.
So yeah, I am trying nowadays to
To be
to
listener.
memorize some sentences and
Yeah.
just repeat them. Just repeat them.
Exactly. Yes.
Yeah.
And be listener. This is the
Yeah.
golden advice. Be listener to the surrogate. He will talk and listen to him. What
Yeah.
he want to say, listen and give him the answers. By this way, you can pass the exam easily. Inshallah.
Yeah. Yeah. I hope it's not a cancer. I'm sorry to tell you, but it's a cancer. Are you saying that my father is dead now? I can understand your feeling, and
Yeah.
I appreciate your condition, how devastated your condition. But yes,
Yeah.
your
Yeah.
father is not with us now. He's passed away. Very short,
Mhm.
very short
Yeah. Our
sentences.
problem is talking. Yeah. We are talking a lot.
Talking too much. Yes.
Yes, you're right. Just learn this lesson is very important to be listener, to give the chance to the surrogate to talk and to answer him according to his talk or to his question or to his concern or to his conversation. Do it in this way. Hopefully you pass this exam, inshallah. Any question, Dr. Salma, Dr. Ahmed?
No,
Thank you,
thank you.
Dr. Basim.
Thank
Oh,
you.
Thank you very much.
oh, thank you too.
Good
Any question
night.
from others? Yeah. Good night. Any question
Thank
from
you,
others?
Doctor. Good night.
Yeah, okay. Thank you, Dr. Yasser. Thank you. Thank you, Dr. Aisha, as well. Thank you, everyone. We'll see you tomorrow, inshallah, with a short clinical day. Good luck and good night. Assalamu alaikum.
Alaikum.